Hi everyone, welcome to our channel, Edume Scientific. I hope you all are doing well. I'm Sharanya, your host for this session. In this session, I'm going to give an overview about liver cancer. So, first, let us see what is cancer. It is a disease condition which develops when mutagens attack the normal cells. Influenced by the mutagens, the normal cells undergo mutations that give them supercellular abilities like immortality and indefinite cell division, which turns them into abnormal and unusual cells called as cancer cells or tumor cells. The same happens in the liver cancer as well. So, based on the type of cells that are mutated, cancer is referred with different names. But the basic concept is same in all the cancer types. In liver cancer, the most common type is the cancer of hepatocells, which is referred to as the hepatocellular carcinoma. Now, let us look at the current status of liver cancer. Globally, it is the sixth most common cancer type, and in females, it is the ninth most common cancer type, and in males, it stands as the fifth most commonly occurring cancer. Now, let us understand who are at the risk of acquiring liver cancer. This includes people suffering from liver cirrhosis, people having chronic hepatitis B or hepatitis C viral infection, people consuming alcohol from a very long time, or people who have consumed food contaminated by aflatoxins. Now, these aflatoxins are nothing but a type of toxins produced by fungi, and these fall under the category of dietary carcinogens. Now, let us know about some signs and symptoms that a person can experience while suffering from liver cancer. This includes loss of weight, acquiring jaundice, developing swollen tummy, anorexia, which is nothing but having no appetite, and pain in the abdomen. Now, let us know about some important molecular targets in liver cancer for targeted therapy. This includes NEK2, which is NIMA-related kinase 2. It is a cell growth regulator. Next is PLK1, which is polo-like kinase 1. It plays an important role in cell cycle regulation. GPC3, that is glypican-3. It is a co-receptor for growth factors. Now let us look at the treatment of liver cancer. Here I am talking about the chemotherapy, as chemotherapy is the most commonly used cancer therapy. In chemotherapy to fight liver cancer, we have drugs like sorafenib, which is a kinase inhibitor, atezolizumab, which is a monoclonal antibody targeted against programmed death ligand 1, cabozantinib, which is an inhibitor of tyrosine kinase receptor, ipilimumab, which is a recombinant monoclonal antibody targeted against cytotoxic T lymphocyte associated antigen 4, nivolumab, which is a monoclonal antibody directed against programmed death 1. Regorafenib, it is a kinase inhibitor. These are some of the currently available chemotherapeutic options against liver cancer. Thank you for watching this session. I hope that this session was useful to you. If so, please share our channel to people who might be interested in such content, and make sure to subscribe to our channel